The Public Safety Standing Committee for the City of Annapolis, our monthly meeting is now called to order. It is 4:08 p.m. on Monday, July the 6th. And at this time, we'll have a roll call. Alderman Dewan Gay.
Here.
Alderman Fred Payon. Number 3, and your chair, Rhonda Pendell Charles, is here. Number 3, approval of the agenda. Can I get a motion to approve the agenda?
Motion to approve.
All right, second, all in favor? Aye. All right, I think that's another aye. Number 4, business before the committee, approval of the minutes from our last meeting. Alderman Gay, can I get a motion from you to approve the minutes from our last meeting?
Motion to approve the minutes from our meeting. I'm not sure what the date is.
I believe it's March the 10th, 2020.
From our March the 10th meeting.
Thank you. Second, all in favor? Aye.
Aye.
All right. So moved and so approved. Number 4B, Public Safety Spotlight. Did you know written reports and comments, year-to-date overdose summary? And we have with us today the Annapolis Fire Department, the Office of Emergency Management, and our Annapolis Police Department. And we're going to start with our fire department. As I indicated several months ago, our public safety team trio has worked extraordinarily hard. It's been difficult work, but they are doing a yeoman's job as far as keeping our city safe and moving. And so unless we had something vital that we needed to meet, I was going to basically let them have a pass on any subsequent meetings until we got through the bulk of this pandemic. But they're here today, and we do have a piece of legislation on the agenda. So we're going to start with who chimed in first, which is our fire department. We have Chief Romali as well as Deputy Chief Spriggs. So you may go ahead and enlighten us on any of those issues, whether Spotlight Did You Know, or year-to-date overdose summary, or anything else you care to enlighten our public on. Thank you.
So good afternoon. I'll defer the OD portion of it to the police department and the Office of Emergency Management. So it goes along with the OD website and the tracking that they're doing. What I can tell you is we have noticed an uptick in overdoses throughout the city during this pandemic. Some of them have been what appears to be fatal overdoses. I know they're waiting on autopsy results for some of them, but we've had some cardiac arrests that we do believe are opioid and overdose related. Only thing I wanted to say is that during this COVID time, the men and women in the Annapolis Fire Department have been in here day in and day out, continuing to provide the job that we do every day to assist the public however we can. Our safe stations operation is still up and running. That has not skipped a beat. I know we've running into a couple, at least 2 or 3 safe stations a week, so that's still going on at the stations. And unfortunately, we've been very busy with calls throughout the city of Annapolis. We had a working apartment fire last week that displaced multiple people, 12 units in one apartment building. So all those families were displaced. It was a pretty major fire. We were assisted by our counterparts in Anne Arundel County, United States Naval Academy, and actually BWI, which is Baltimore, Washington, Thurgood Marshall Airport Fire Department, came out to assist us. While we were fighting that fire, units from Queen Anne's County actually staffed our stations along with some other Anne Arundel County companies. So we were staffed throughout. But we've been running all types of incidents throughout this pandemic. We had a drowning the other day, unfortunately, in Spa Creek, where we had our marine resources out there and our joint county city dive team. So we've been extremely busy. And to top it off, like the rest of the nation, we've been running down fireworks complaints all weekend long because it's been a major uptick in fireworks throughout the city. Some of them legal fireworks, some of them illegal. But we over the weekend, we had a couple dwelling fires that were a result of fireworks, the improper use of them. Automobile was also on fire from improper fireworks, some dumpster fires, and we had one young man that was burned using fireworks. But just so the public knows, the police department and the fire marshals have been out there. Every time we get a concern, we send units out there. If they're legal fireworks, we make sure we educate the public to assure that they're doing it properly. And if it's illegal fireworks, they are actually confiscated. So I know that several of you older persons have been getting complaints about it. And just rest assured that every time a complaint comes in, the police department's sending somebody out there, and our fire marshal's been working all weekend to correspond with them to take whatever actions they needed to take. Chief, you got anything?
I would just echo what Chief O'Malley mentioned earlier. The men and women in the fire department and all of public safety to that extent, with police and the Office of Emergency Management, have all stepped up during this pandemic. The use of leave was almost zero. We were almost having to beg people to not come to work because we didn't know how we were going to be able to allow them to use their leave. So as the chief officers here, I can tell you we were extremely proud of how they all stepped up and handled every single call for service, whether it was a sick person or a fire or some other type of accident. I just can't say enough about the dedication of the employees that we have here in the city and how well we work together with the police department and the Office of Emergency Management. And then again, the last point I would make is something I made last week with regard to the fire that we had on Spa Road. All the city departments worked really, really well together. The public safety agencies, transportation, public works, you name it. I mean, everyone really came together to really help those citizens that were displaced with that large fire on Spa Road. It's unfortunate. We have one of those every so often, and to have it in the middle of a pandemic made it that much worse. But everyone stepped up. Everyone showed how great a team we are, and it just really, really showed the spirit of Annapolis.
Thank you, Chief and Deputy Chief. And what you all have pretty much encapsulated is a day in the life of the fire department since this pandemic. And so I want the public to know all the things, as many things as you can outline, what you all have been dealing with and coping with over the past mid-March. And I think it's important to know, I don't think the public really totally understands or realizes what we are facing, what we have been facing, and you all have come up, all of 3 departments, like shining stars. I'm in on those briefings several times a week. I hear what's going on, whether it's from the recovery zones to police, fire, and Office of Emergency Management. It is truly, truly unbelievable what has been going on and what's been done. And to be quite honest, oftentimes people don't truly understand because you all make it look so flawless. And so it doesn't look like it's hard, but I know it's difficult to maintain that level of service and professionalism. And we thank you all so much for it. And I'm going to ask Office of Emergency Management as well as police to kind of as well join in a day in the life of your departments since we've been through this pandemic. But anything else you'd like to add as we go along, certainly feel free to do so. Okay, we'll move on to the Office of Emergency Management, and I know Director Simmons will give us an update with that fire, as well as every department that was involved, down to even Public Works, because we had the down tree. So Director Simmons, go right ahead. Thank you.
Yeah, I think that the fire department, this is Kevin Simmons, I'm the emergency manager for the city of Annapolis. I think the fire department summed it up best, and Chief Spriggs said that we are a good team and we work together. And I think part of it is that for the last 10 years, we do a citywide preparedness exercise. I've worked with 3 administrations of Annapolis government, and all 3 of them supported the citywide preparedness exercise. And I think that throwing us all together once a year to work out an issue or problem, whether it be a hurricane, tornado, floods, snowstorm, active shooter, it makes us better. You know, we can get in and we can look at what we're doing good and stay on track, and where we need improvements, we can correct them. So just that gesture and that training, I think, makes us the best team. But I wanted just to remind the Annapolis community that we're still in the throes of a COVID-19 pandemic, and it's important in order to not regress and not go back to severe restrictions that we just came from. And if you look across the country, in Delaware, they're starting to see more of a surge. In Virginia, is starting to come up on a surge. In the Deep South, in the West, you know, they're actually rolling back and going back to where we just came from with all the severe restrictions. We don't want to go there. But it's like 3 simple things you can do. I mean, they're insanely simple. And that's maintain public distancing and to wash your hands using the 20-minute rule. And above all, wear a mask. Above all, wear a mask. Now, OEM, in partnership with the health department, offers COVID-19 tests every Monday. The test sites are rotated throughout the city, and just call 410-216-9167 for more information. To date, we've had 12 testing opportunities around the city, and we've been at Parole Health Center, Harbor House, Eastport Terrace, Morris Blum, Tyler Heights, Robinwood, Morris Blum, we did a strike team there, Pitt Moyer Rec Center, Annapolis Walk, Monarch Academy, Annapolis Gardens, and 1000 Madison. And we were there for 2 weeks in a row because some of our highest numbers we found was in the Eastport area. So we wanted to stay there another week. So we're looking, and we should have an idea by tomorrow where we're going to be next Monday. But if you need more information, again, call 410-216-9167. We also, I want to talk a little bit about our non-food giveaways that we've had since COVID-19 pandemic has struck. When the pandemic hit, it left a lot of people in need of different services, and food assistance was one of them. So we were able to serve 3,600 families, which equates to 13,500 individuals. And our next food giveaway is on July 14th and July 23rd at Pitt Moyer. We start at 12 until we run out. Again, our testing, going back to my testing too, my COVID-19 testing, that starts at 10 and it ends at 12 noon. So, is there any questions?
One thing, Director Simmons, you said 20-minute hand washing. Let's drop that down.
20 seconds. 20 seconds. I always do that. That's 20 seconds. But if you want to wash for 20 minutes, I'm not mad at you. So one more thing too. Chief Romali talked about our drug overdoses in the city of Annapolis, how he saw an increase with this pandemic, especially once we went into stage 2, we started seeing a whole lot of overdoses. Currently, there are 84 overdoses, have been 84 overdoses in the city thus far this year. Out of those 84 overdoses, 7 has been fatal, they died. And we still have 4 pending the medical examiner's disposition. So all in all, if the medical examiner finds these as drug-related overdoses, we'll be at 11 mid-year. And we had 13 of all of last year. So we're not on a good track with that. As far as the wards where we have the most overdose, in Ward 6, we've had 17. I'll just do the top 3. And in Ward 6, we've had 17. In Ward 3, we've had 16. In Ward 2, we had 15 overdoses. So we certainly have more work to do in that area. We put in for a grant of $98,000 to the state for more resources to support our 4 programs, the program we have in the mayor's office, the program we have in the fire department, police department, and OEM.
Director Simmons, when will we be able to, like we did before, targeting those communities and moving from community to community with the resources and the information that we need when it comes to substance use disorder. When can we start that back up again?
Well, a lot of it was kind of restricted by the pandemic, and we're just going into stage 2. I see more opportunity to do that, but we need funding. I'll give you, for instance, now the police department has a program that we funded where a police officer and a clinician goes out to visit the person that overdosed on every overdose and all. So they had to do it virtually. So that didn't work too well because a lot of folks don't have that resource and those capabilities. However, the money just ran out for the clinician. So that puts us in a little bit of a quandary. So we're hoping with this $98,000 that we put into the state, the Opioid Operation Command Center, that they'll see favorably on our grant. Dr. Kalyana Raman, the health officer, has signed off on it. He agrees with all the programs and how we laid it out. And with his signature, it goes up to the state. So we're waiting to hear from that. And I think that once we get more resources, we can be a little bit more aggressive, and especially with the harm reduction and the follow-up with the clinician and the police officer. I think that's a really good program. All of them are good programs. Your Life Matters as well has had a great impact. The NAM has had a great impact. OD Free from OEM has had a good impact. I think we have a cadre of good programs. We just need to get a little bit more resources to keep them robust.
Okay, sounds good. Director Simmons, Alderman Gay has a question, but when we come back after you've answered that question, if you could just give us, and I know we're going to have a work session, the council will, on, I think it's next week, next Thursday, on the fire, but if you could tell us every department and outside agency that was involved in that, and just give us a one sentence on each one, what they did and what they were involved in, I would appreciate that. But we're going to go, if that's okay with you, Director Simmons.
You're the boss. You're the boss. Okay. That's okay.
I'm just, and so Alderman Gay has a question. Alderman Gay.
Yeah, thanks, Alderman Pendel-Charles. And my question is just, is there a rough estimate on the timing when we would get those resources? Also, are there current funding sources that we have that we could pull from? Because I remember that when Ward 6 was, unfortunately leading in ODs previously and fatal overdoses previously, the outreach, as Alderwoman Pendel-Charles mentioned, was key into helping reduce that. And so if the funding becomes available, or when it does become available, I guess is the question. Are we prepared to then hit the ground running again and making sure that NAM in particular is out there? I think that was kind of important to me because it also had the mental health resources through Arundel Large with Michael Drummond. So is that something that can be continued? And also, could you break down the number again for Ward 6? I only got the total, sorry.
Overdoses this year in Ward 6 is 17, and Ward 3 is 16.
And fatal?
I don't have the fatals in your ward, but the fatals totally is 7.
Pending 4 autopsies.
Yeah, and 4 pending, yes. Until we get the disposition from the medical examiner, there are 4. So,
Director Simmons, I have a question. I know the last time when we were traveling from community to community is virtually, and now that's what we're doing. Do you have some sort of idea as to how that would play out again? Are we still going to physically go to communities, or are we going to do it virtually, or is it a combination, or do we meet people at the door and only allow a certain number in at a time? Have we kind of worked through any of those logistical issues?
We have not, but we have some ability to reach out. So what we put in for the NAM, I think that's what Alderman Gay was referring to. it's not so much NAM as they changed it to no harm from the mayor's office. So basically what we're asking for there is 10 youth community engagement sessions, which will probably have multiple in your ward there, Alderman Gay, and then Alderwoman, we'll have multiple in your ward as well, because you guys have the 2 highest numbers. And then 5 community resource days where they have an event that offers various resources in these areas that are affected. And they're going to do 10 PSAs and webinars. They're saying webisodes. So where we might not be able to get in, let's say we have a surge and we can't, everybody's locked down again. We can always do the PSAs and the webisodes to help us out to then. So in the fire department, Your Life Matters, which is going strong. The best thing about all this stuff is these are established programs. I just need to get the money to them. So in the fire department, they're saying they're going to participate in at least 15 community events and host 25 community training sessions, which is pretty effective. They aim with this funding. They want to train 30 businesses, and they want to train 750 laypersons in OD recognition. I think that part of it is new and all. So in the police department, their overdose reduction initiative program in the police department, they still want to continue the clinician officer team, connecting those who have recently had an overdose, and then they want to host 10 youth programs. And then in the fire department, we have the OD-free dashboard and website. We want to actually redo it and make it better. And we want to support at least sending 3 opioid intervention team members, as we did before in Alderwoman. I think we offered it to you and you couldn't go, training and going to conferences when everything kind of clears up. And I think we sent about 6 persons to Atlanta right before the pandemic, the summer before the pandemic, to a good conference there. So to answer the Alderman's question is that we're waiting at any time right now to hear back from them. And former county executive Steve Shue actually reviews the grants and makes the decision, him and his staff. He's the head of the Opioid Operations Command Center. So is it any other questions about that? I think we're moving along.
I think Alderman Gay had another question. Alderman Gay?
Yeah, thanks. So outside of the youth engagement, I guess my first question, because I shouldn't make the statement without knowing the answer. If you're looking at the opioid overdoses over the course of the last year, or even if using the data from last year, would you be able to tell the age demographic that it ranks highest in? I'm assuming that is the OD, not the addiction. I'm assuming the overdoses is like 30s to 40s, or.
So in the city of Annapolis, it looks like 9 overdoses was from age 18 to 24. It looks like from age 25 to 34, it was 25 overdoses. And the age range of 30.
25 overdoses in the age range? 25
to 34. In the 25 to 34 age range, it was 25 overdoses.
Okay.
In the 35 to 44 age range, it was 19 overdoses. In the 45 to 54 age range, it was 15 overdoses. In the 55 to 64 age range, it was 11 overdoses. And older than 65, it was 3.
So it looks like, as we go up until 55 through 64 is There is a high number. It's 25-16 or 25-19-15, 11. So what programs do we, because I had a similar situation, I think we talked about it previously, with a resident in my community where they wanted to get help. We got them help, but there were, I think two things that stopped them from being successful in that quest for help. The first being financial resources to receive, to receive the best care. Being able to leave or being able to, travel and obtain resources. And the second with being programs that had to do with their age and, finding that. So are there things within those two areas that we can help out within the city? Are there programs outside of the programs that are run by or that are funded through and directly overseen by government entities that help individuals get access out of the state where they aren't surrounded by, maybe family or friends or just the same social scene that would, keep them involved in this addiction?
Well, I would say two things. I would say number one is send them to safe stations. That would be number one, because they have the experience. They've been doing this a long time. They have a level of success that's phenomenal. I mean, you have folks from all over the country coming here to Anne Arundel County and Annapolis.
If you go to a safe station, though, you are then sent to a facility within the county. I know one of them I've actually driven someone to, and I'm not sure where the other one is. There are two main ones, correct?
I can't answer that question. I don't know, but here's what I do know. I do know that crisis response comes in and they evaluate that person for what their needs are. And then from there, they get them to the appropriate help and the resource. Now, in my experience in dealing with the opioid crisis and all, when we developed the substance use disorder bed finder program, we had a whole cadre of treatment centers that were participating. So in my mind, I never really followed one through from safe stations to crisis response to what treatment center. I know it's a lot of different treatment beds and levels, and I couldn't name them all, but it's a good dozen of them, I think, and where they go from there and who they go to. But I know that in our sphere of getting treatment for folks, that it's a whole bunch of different treatment centers that's available, to include the hospital. I don't know how well that answers your question.
Yeah, it does. It helps. And I think that maybe what's needed is a way to, with protecting the confidentiality of the individual, just obtaining information on where they are in the process, or are they repeat? Have they overdosed several times? Are we able to track that? Because I think that, if we could pin on that, then we'll be able to key on or at least reduce the numbers. I don't know, maybe because of the spike in Ward 6, that could be a preliminary trial where we just follow up with people when they, once they're admitted, we see where they go, if they come back, how they adapt, just finding out what the issue is, because I have a feeling that a lot of it is repetitive.
So you're probably right, but the good thing about what the Annapolis Police Department has going with the Overdose Reduction Initiative program and the clinician and the officer working together in the city of Annapolis is that they become familiar with all the overdoses, and they have a great crime analyst now. And what I use my money for with opioids is I get a part-time person to actually do all my stats. So I think putting that team together and looking at putting the crime statistician and the clinician and the officer, and then my person from OD Free. I think we can capture all that information, and from that information, we can hone our programs and make them a lot sharper and more effective than what they are now. Not that they're not effective, they are, but we can always get better.
Okay. Alderman Gay?
Thank you very much.
Thank you. And the other thing is, too, it sounds like to me, Director Simmons, last year before, basically the overdoses were centered around persons 45 and over. It sounds like the ages have dropped in the city. Am I correct?
Well, I didn't do the math, but you know, if you take the 45 to 54 category, the 55 to 64 category, and the 65 plus, it'll be almost as high as the 25 and 34-year-old group, okay, which is 25. So okay, I think we still might be high in that category, maybe be higher than 25. So that's okay. Again, what we found is that we have a lot of long-time heroin addicts that's been around for a while and been using for a while, and then they introduced fentanyl, and it just changed everything. We started seeing more of them overdose and more of them dying from it.
And
go right ahead, Alderman Gay.
Can I ask one last question? When you, maybe this would be for the fire or police, but when an overdose is called in, is there a stat or a breakdown off of if this individual is is it an in-home overdose, or is it like outdoors? Is this their ward? Do you break it down that much, or is it just broken down based on age, race, and
there's more.
Is that question for fire and police?
I wasn't sure who. I'm sorry. I just was like I guess it's a system. Once fire or police are on the scene, then they give that data to you, and it's broken down in your office.
Yeah, we get most of our data from the crime analyst. Yes, we do. So that would be a good question for the police.
Okay.
Alderman Gay, the other thing is, too, we used to get our data from the county police department, but several months ago, they stopped. And I'm sure, and I know, Director Simmons, we're still trying to go back to the county police department to get that same data we had, whether that was their home, whether it wasn't their home. So we were getting a lot more data. But now with our new crime analyst who came on board about 6 months ago, I think we're going to go back and we're going to start recreating that model again and getting that data. Am I correct, Director Simmons?
One of the things, too, is that is prevalent in urban areas is a PCP usage. So we found that we got very good data from Anne Arundel County. Anne Arundel County Police was great and all, but it would tend to be off a little bit from what we're seeing, from what they're seeing. Plus, we take note of PCP as well. So it's not so much an overdose like you have an overdose with opioids, but if it's a bad PCP experience where fire's called or police is called and all that, we kind of chart that up as an overdose, and we keep looking at that. Again, that's prevalent in urban areas, and we want to make sure that we keep watch and devote some of our resources to thwarting PCP usage and bad reactions in the city of Annapolis.
Alderman Gay has another question.
Yeah. So does that affect our numbers then? Because if we are accounting for, I remember we had this conversation previously, but at the time it was still, there wasn't any actual data on it because they weren't sure how to categorize it. But I think now it's the same is if PCP overdose is not like a heroin overdose where we have to apply Narcan or some other medication to revive them, then why do we account PCP overdoses as an overdose? Because I think in the last meeting that we had, we were saying that if they pick someone up from a PCP overdose, they usually you're having to like calm them down from like a body, like they're overheating almost. And so it's important to cool them down. So they aren't experiencing like overdose, are they?
I use the term bad reaction, but it could be a number of things. It could be anything from being violent. It could be anything from undressing and running around. It could be a host of different things. But I think it's when we have incidents of PCP, I think that we have a responsibility to note them and address them, because just like we have an epidemic with heroin and other opioids, we can certainly have the same thing with PCP. Now, if you want to know what drugs are being used in Annapolis this year, we've had 51 overdoses related to heroin or some other kind of opioid. We had 3, which is some other drug, could be amphetamines or barbiturates or whatever. We had 5 PCP, and then we had 25 in the category of unknown. And that gives us our 84.
25 are unknown?
Yes.
So this is like a new drug possibly, or is this just, are they, because of it's just like a street drug, it's something generic?
I'll let the police answer that question. That will be one that you can throw to them. But unknown can mean a lot of things. It could mean a lot of things.
Okay, and so just, so I'm sorry, I'm just trying to get to the basics of a basis of what we can do in Ward 6. And so of the 84 current overdoses we have, 51 of them are opioid or heroin related. That's helpful. And the other, would be PCP related. So, so would you be able to get me possibly a breakdown of Ward 6 of the 17, splitting that up in between the drugs like heroin, the other PCP, and the unknown?
What exactly are you asking me so I can make sure I get you the right information?
So the 17 overdoses that we have now in Ward 6, if you could break it down by the drug like you just did for the overall totals.
Am I doing that for you too, Alderwoman, since you have the second greatest amount?
Yeah. And in fact, Director Simmons, it would probably be a good idea to do it at this point for every council person.
Okay, so I'll turn this over to my tech person, and I may need some help from the police department with their crime analyst as well. So I'll reach out to them and Captain Seidel and see. I'll get some help from them to help me compile this stuff.
The other thing is too, and if you can, add in those other components that the county used to provide to us, if you can, so we can kind of get a handle. You and I have had that conversation. Unlike my ward, it's pretty much, from what I could glean, more scattered. It's not necessarily concentrated in one community, but it's more scattered than in some of the other wards, as like Ward 6. So, but no, I think it would be good for all of us to get that data from you and all the wards, no matter how large the numbers or how small they are. So that would be very helpful. The other thing is too, okay, go ahead.
Me?
Yeah, go ahead. Mm-hmm.
What I want to encourage everyone, especially the older persons, because I get a lot of questions on opioids and overdoses, is to use the OD-free Annapolis and the OD-free dashboard. Very easy to use. Alderwoman Rhonda Pendell Charles, we sat down in my office and I show you how to use it. And I think you would agree that it's fairly easy to use, right?
It is.
Would you agree?
It is. Yes, it would. Yes, it is.
I have the heat map up right now, and I have it on Ward 6, and I just push one of the dots on Ward 6, and it said drug is heroin, Narcan use, fire, EMS. Was it a fatality? No. What was the age range? 25 to 34. The race was white. The gender was male, and all. So, when it was entered into the system, it was entered into the system July 2nd, 2020 at 9:40 a.m. So you got all this kind of information, and people want to know a lot of information. Can you send me information? Now, the information that you want, I have to further research, but a lot of information you can just go on OD Free and get that information. That's available to not only to you guys being elected officials, but the general public.
Now, Director Simmons, not to overstep confidentiality and privacy, is there any data that you can get from the police department that you could either put on your dashboard or send it to us confidentially? Is that possible?
No, all the information, I feel comfortable with all the information because the questions that you all ask me, I just go to the dashboard and look at it. And that satisfies most questions that come from folks and what they want to know. Now, if you need to drill down in deep specifics, then we may have to get with the crime analyst for that.
Okay, good. Okay, and when you send it, just make sure you put that caveat in there that it is on the dashboard. We can see it, but if we want something drilled down more, just to let you know, and we'll work with the police crime analyst on that. The other thing is to just want to give you an opportunity to talk about harm reduction, fentanyl strips, and whatever else that we're working with.
So harm reduction is Narcan. And people forget that Narcan is harm reduction. You know, you're keeping folks from dying. So it's harm reduction. That's the biggest harm reduction tool that we use is the fire department uses it, the police department uses it. We train folks in the community. People like Rita Dorsey, they're very good with this. Tony Pratt, they all pretty good with getting out there, being trained, and they actually put it to good use. Now we do have fentanyl strips, and we did have a person, and we still do have a person who does fentanyl strips in the street. And they know the areas, they know the people, they know the game, and they can get our fentanyl strips out, and that way folks can actually test their drugs to find out if there's fentanyl in it. Are they going to not use it? Probably not. They'll probably still use it, but they can do different things. They can use less of it. Instead of injecting it, they can snort it, or they can take it in the company of somebody with Narcan. So I don't think when they find out it's fentanyl in their heroin, I don't think they're going to throw it away, but they have other options as not to overdose. So, and I do believe that when you do these harm reduction tactics, the next step is to get them to go for help. So if they're receptive to that, they would be receptive at some point to get help and treatment to get out of the game totally.
The other thing, Director Simmons, can you just give us a few words about AA Power? And then I'm going to either let the chief or deputy chief give a little more information concerning the Safe Stations program, since they do get the bulk of persons who come to them versus the police department.
AA Power is a health department. They've been helping Annapolis pretty good. It's a health department program where they use ex-addicts as a communication tool to present addicts to get them help and resources that they need. So when we have a spike in overdoses, one of the tools that we use is to call AA Power and send them into that community. They usually come into the community. They will let us know that they're in the community, to let the police department know that you may see a table set up and you see these folks interacting with people who are caught up in our drug community. that's what's happening is they're interacting, they're intervening, and they're giving resources to these folks, trying to turn them around, trying to give them some other alternatives.
Okay. Deputy Chief or Chief from the fire department, did you want to add anything about the Safe Stations program, since the majority of people come to you?
Sure. We started this program a few years back, and any person can come to any of our city fire stations or any of the county fire stations. They can also go to the city police department or county police department. But I think the majority of people feel more comfortable coming to the fire stations. And they can come there anytime, 24 hours a day. Obviously, we're always there. We'll have firefighters greet them. They'll take some vital signs, especially with the pandemic going on, to make sure they're not running a temperature, to make sure they haven't had any COVID symptoms. If they, are experiencing a medical emergency, we'll transport them to the hospital if that's appropriate, if they need medical intervention. But most times they have some survey sheets or questionnaires where they'll ask a series of questions, obtain some information from the individuals, and then contact crisis management. And then we'll actually stand by with them until the crisis response team arrives, and then they'll come in and conduct their interview, and then have the proper placement for those individuals. So we had 4 last week alone, but it's been relatively steady even throughout the pandemic. So we're encouraging people that if they want some help, our fire stations are here, our firefighters are here, and that's just one other service that we are happy to provide.
Okay, thank you. Alderman Gay, did you have any questions for Deputy Chief Spriggs?
Quick questions and then a quick statement. I think that we're just looking at the OD Free Annapolis website. One, looking at the breakdown of last year to this year in terms of the numbers broken down by ward, it's completely different. So I'm sure it's trouble tracking that and figuring out how to stay on top of the pace. So if you could speak to that, with seeing how last year was 6 and 4 have 6, 4, and 8 having the highest, and then this year is completely flipped around with 6, 3, and 2 having the highest, and then also the gender and race breakdown of it is crazy, with 72% being male, 27% being female, and then the race 40 being Black, 5 Hispanic, and then 39 white. This website is cool, the little dashboard that they were mentioning. So just speaking to that briefly. And then with harm reduction, as he was mentioning, the Narcan and fentanyl strips, I think we have done a good job in the past of handing those out and staying on top of that. But in order to prevent overdoses, similar to like what they do with sex education, in order to prevent STDs, they just make condoms free. You can walk into a community center and like grab them in a bowl, or like they do with prevention for COVID now, there's hand sanitizer everywhere. It's like in community centers, on side of buildings. So why don't we just put it in the communities? Why is that? If you have a bowl or something with Narcan and fentanyl strips, obviously not for the promotion of, but so that we, decrease overdoses and get on top of fatal overdoses as well. Is that an option?
So
to put this,
go ahead.
Was that the deputy chief?
Yes, sir. You can go ahead.
So the question is that we just like condoms, just make it available.
Yeah.
Well, the strips actually cost. I forgot how much they cost, but it's about $1 a piece, or maybe a little bit more. So 1,000 strips will cost you $1,000. I think 1,000 strips will go fairly quickly. Plus, we have to actually do paperwork and account for the strips. So I'm a proponent of putting the strips out there, just like you say, and getting them out there. But I do believe that having the connections, who knows the street and knows the people, and have the confidence of those present addicts, and they get the strips to them. I think right now that's probably the best way, and we need actually more people doing that.
Yeah, that was my concern then, because if people are not able to hit all the neighborhoods, or like I said, if you are thinking that Ward 8 or whatever it may be the hot place, but it's actually 6 and 3 and 2, then there's just so much going on. When I worked with Delegate Penna Melnick, she actually had legislation submitted, and we helped out in the office for and we talked about this previously, of just making a safe use site within communities. This way the resources are constantly available, and we aren't relying on volunteers and individuals that we gotta, build relationships with off of the streets to kind of take responsibility for the overdoses and fatal overdoses. And I really would like to see something like that in the city, if we continue on an uptick of overdoses, where we maybe go through a test run with a safe site. They were called safe injection centers, so that you are monitored, and they have all of that stuff there. And I just think the science proves that when they use it in Europe and things like that, it actually helps decrease the number of overdoses and fatal overdoses, and even use within communities. And I think there's actually a couple of facilities in the United States as well. Obviously, with the zoning is complicated because of the use of the facility, but I don't know. I think it's something that we could get behind, and it's proactive and a new approach. But I'll allow us to move on. I'm sorry, I got kind of caught up on this.
No, that's what we're here for.
Just one thing, I don't have stats on that. It'd be interesting to see what the stats say and all that. But we have a tool that we can use, that Wellmobile. We should be getting that Wellmobile in the city of Annapolis, and we should be introducing buprenorphine to our folks that are addicted to substances, and using that as a way for them to get out.
That's coming from COVID, Alderwoman Pendel Charles, correct?
That is correct, Alderman Gay. But the thing of it is as we know and as we've heard professionally, those who are more susceptible to contracting COVID are those either with high blood pressure, diabetes, or obese. And so we're going to attack it from the situation of healthy eating, healthy living, healthy nutrition, rest, diet, exercise, and therefore you're less susceptible to contracting COVID-19. And we're going to work with adults as well as children. And so that's going to be our premise when we get the Wellness Mobile up and running and moving from community to community. And this data will definitely help us. If Ward 6 is the hot spot, then we'll go there and we'll have a either physician or a clinician on board to drive the Wellness Mobile. We can give out the messages. We can give out the fentanyl. If we know, like I said, is a hot spot, we'll move from 6 to 3 to 2 and back around again wherever we do. So this will be a great service to us. And I always like to give credit where credit is due. I went to the health department of the state, talked to a health officer, well, now deputy health director of the state, Fran Phillips, as well as our former city manager, who's now the chief of staff there, Tom Andrews. And they suggested that I talk to Dr. Knowledge, who was coming on board back in October. I met with them in the late August of last year, talked to Dr. Knowledge in October. He was the one who came up with the idea about the Wellness Mobile. And we're going to get that started, and we're not going to get totally out there, but we're looking for three people to reimagine the police department like we talked about. And hopefully we'll have the Office of Human Services and Caring Communities up and running, and we'll have one assigned possibly, and this is, I'm just throwing it out there, one to OEM, one to the police department, and one possibly within the mayor's office as well. So it's going to be a whole systemic issue, and I want folks to know that we're not just doing that based on 6 weeks ago with the George Floyd, terrible death of George Floyd. We started this 3 years ago when one of my Ward 3, Ms. Shank and Mr. Keller, who's Human Relations, came to me and brought me information about the what Oakland, California was doing with violence prevention. That was 3 years ago. I came up with some legislation 2 years ago. We were looking for some funding from the county. We did not get it. We had 6 sponsors on that piece of legislation. I plan on bringing it back, but reimagining and having another piece of legislation where we can have what we know that we need. And I think, and I know that Annapolis is a good place to start. So we're going to be working on this Office of Human Services and Caring Communities. And so we're going to blend it all together. But I don't want people to think we just started this. This is a road we've been on for 3 years, legislation 2 years ago, and we're going to continue on that road. So thank you, Alderman Gay. Thank you, Director Simmons. But Director Simmons, can you give us just a few sentences, like I said, on the fire? I want people to know for every agency within city government as well as outside organizations that help with that fire. And I appreciate you doing that for us.
Just very, very briefly, the OEM is a coordinating agency which kind of coordinates resources. So we assisted the fire department by coordinating the following agencies: the Red Cross, who interacted directly with the displaced individuals to get them finances to find a place to stay overnight. Crisis response to help with their mental health. They're going through a traumatic event, and we had crisis response there. We also had Rec and Parks that provided a staging shelter facility, so we can actually, they got somewhere dry, they got somewhere where we can actually start the process of getting them some help. And in Public Works, during the midst of this whole thing, we had a storm come through and knocked a tree down across Silipana, right near Spy Road, and that impeded some equipment and some traffic. They came right out, called the acting director. Acting director sent the crew right out. They cut up the tree and removed it right away. And then we have the management of the Hilton Garden Inn on West Street. They didn't hesitate to take in the folks that were displaced and their pets. So working as a team, we were able to make the best out of a bad situation for these folks.
And you had transportation provide not one, but 2 modes of transportation.
And you know what? Rick Gordon helps me out so much. I call him like at midnight for stuff, and he always sends buses. So I missed probably one of the biggest players is transportation. As always, we call Director Gordon. Director Gordon responds without hesitation. We just needed 1 bus. He sent us 2 buses for good measure, and I always appreciate his assistance.
The one thing I was struck by, and this is a kind of a personal story that Deputy Director Mandel brought up. There was a lady who was transported to Rec and Parks, and she had left her purse with some very valuable items at home, and she directed someone from one of the agencies where to look. Go in the door, go to your right, go to the back of the closet, and it's a blue purse. And the fire, I think it was fire, went and got all of her purses and brought it to the Rec and Parks so she could choose which one that she knew it was. And I thought, wow, we go way, 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 way beyond the call of duty. And I thought, as a female who carries a purse everywhere, I thought that was really a moving and touching experience to show what dedication we have within our city government.
Well, there were a couple different experiences like that. Not only with that one, which is very, very good, but we also had one of the displaced folks with no shoes, and then we had a newborn who needed Pampers. So we just got the credit card out and we bought, newborn infant Pampers, and we bought the person some shoes. So
Right.
It's all, you know, we try to go above and beyond. I mean, we're in the throes of a pandemic, like we said, but you know, we have some objectives that we follow, and the first two objectives kind of commits us to making sure that our core essential services are always carried out, even though we're in a pandemic. I think that Chief O'Malley and Chief Spriggs said something about it. You know, we're dedicated to making sure that our citizens don't get less than because of this pandemic, and this event, that fire last week, illustrates that.
Right, and we put the same energy into our substance use disorders and our pandemic, and we're on the right track. And so, and everybody's in agreement, and everybody's passionate about what they do, and we really thank you all for it. Alderman Gay, did you have any other questions for Director Simmons? Okay, we can move on to police. Lieutenant Miguez is here from the police department, and feel free to give us, add some information or whatever you need to indicate to us that would be good for us as well as the public, Lieutenant Miguez.
Yeah, thank you very much, Alderwoman Pendel-Charles. I just wanted to make a couple comments on some things that came up earlier in the discussion about the overdoses. The numbers, we have the stats, obviously, for the stats that we have, but we also have to realize that since there are probably a lot or some situations where citizens are administering Narcan, that some of those overdoses won't go reported. And so there's going to be some overdoses that aren't going to be in that splash page that OEM has. If citizens are administering Narcan and then not contacting any public safety agency. Also, I believe Alderman Gay had a question about whether the stats captured where exactly the overdose occurred. And I know that as far as the police reports go, the report would indicate whether the person was located outside or inside a house or an apartment or residence or something like that. But I don't know, when they export those stats, I don't know that there's a field for whether it was inside, outside, where exactly that occurred. You also had a question about the cause of the overdose and those stats on that page that OEM has. That category of unknown, I believe most of that is based off of, at least on our side, the officer's assessment of what is the cause of the overdose, whether it's by the person's behavior or their symptoms or information that they're getting from the person themselves or people around the person that's suffering the overdose. And so whether it could be somebody who may have taken a combination of drugs, or, they may not want to say what drug it was, then we don't want to just make an assumption that it's some drug without, some positive indication of that. And then, let's see. Director
Lieutenant Miguez, I remember when we were getting information from the county, it would indicate whether it was at the person's residence or not. It would be just a yes or no.
Oh, okay.
Yeah.
Interesting. Okay. I'll have to check. And what I'll do is I'll get in touch with Captain Seidel. Director Simmons said he was going to be looking for some information to coordinate between our crime analyst and them to get you the information that you're looking for. So I'll be sure to send him something and let him know what exactly you're going to be looking for, and that Director Simmons will be in touch with him. So they should be able to get that information or maybe modify how the information is exported so that they can capture that information that you're looking for.
Thank you, Lieutenant Miguez. Anything else you might want to address just briefly too. We've had several protests, whether it's Reopen Maryland or based on the police brutality incidents that we've had across the nation. Did you want to address any of that? I think the police, well, based on what I've seen and heard, have performed in a very admirable way. We had two protests on the same day. At the same time, the police brutality issue protest, as well as the Reopen Maryland on the same day. So did you want to speak a little to that?
Just that everything has gone well. Everybody that's come out to demonstrate and express, their opinions and their concerns, everything has gone well, and we're very thankful for that. We had, I believe the last one was last week. The other thing, you just reminded me about the overdoses. Alderman Gay mentioned differences between last year and this year. Some of those differences in geographic locations of the overdoses may be chalked up to the restrictions placed on businesses as well as people due to COVID. And so people going to different places to get their drugs than they would have under what we would call normal conditions last year. And so that may have an impact on it. But Alderwoman Pindell-Charles, back to your question about the demonstrations. Like I said, everything's gone well. We've been able to field the officers for those events, and looks like everything has been going smoothly with the recovery zones as well, and the road closures around them. I've spoken to a couple businesses that have been, had positive comments about the efforts of that. So looks like everything is going pretty as well as can be expected under the conditions.
And we've had a lot of partners when it comes to those protests as well that we've depended on as always. And I also want to give a shout out to Alderwoman Tierney, and most of them have been in her ward and Ward 1, and she's worked tirelessly, whether it's the Small Business Recovery Task Force or it's the protest. She's been out there on the ground, boots on the ground, and being very responsive to the residents in her ward. So can you list a few of the partners, whether state or county, that we've been able to lean on when it came to the protest?
I know a lot of those ones in the downtown area. We've been working with Maryland Capitol Police because it's kind of been on our area as well as theirs around the State House. I know also we were working with the fire department, with the fire marshals in screening areas with their canine units. And then I know that when we've reached out to the county, Anne Arundel County Police Department, they've let us know that they're, have people able to assist if we need them, as well as the state police. So it's always good to know that everybody's willing to work together to make sure that everybody stays safe as they're able to come out and and demonstrate, and we can make sure that traffic is controlled around those areas.
Lieutenant McGinnis, I just want make sure one clarification. When you mentioned canine units, mainly they are looking for sniffing of explosives or that kind of thing, just to make sure that people know that's what we're basically using the canine units for.
Yes, absolutely. Sorry, I didn't clarify that. Yes, they're usually scanning areas around where protests are going to be for explosive devices, and that's always a step that we need to take, again, just to make sure that everybody's staying safe.
Okay, thank you so much. Alderman Gay, did you have any other questions? Okay, I think he stepped away a bit.
No, I just had to sneeze. Sorry about that.
That's okay.
No, I just was that was a good point mentioning on the COVID closures being as to maybe why the wards differentiate this year.
Okay. Anyone else have anything to add either from fire, OEM, or police? Okay. Well, thank you all so very, very, very much. We really appreciate your hard work, your diligence, your passion, your professionalism. Like I said, there's a lot of logistics that go into what you do every day that the general public is not aware of, and understandably so. But we're here because we haven't had a meeting since March. So this may run a bit over, but it's well worth it because I know the public needs to be well aware of what's going on in our public. And I want to salute all of you for the hard and diligent work that you do, that our leadership should be very commended. We'll start with the mayor and work our way down to leadership, as well as those who are there on boots on the ground within the departments. All of the departments in the city have been there when we needed them, and not surprising, but they're there when we need them. So thank you all so very, very much. And we'll move on to the next agenda item, which is legislation. But thank you again so very much. Godspeed, and you all be safe out there. Number 5, legislation. Thank you. Legislation before the committee, O-14-20, parking spaces reserved for plug-in electric drive vehicles for the purpose of establishing reserved parking spaces for plug-in electric drive vehicles, creating certain definitions, establishing penalties, and making stylistic changes. And we also have one amendment from Alderman Savage as it relates to, I believe it's the fine part of it. So we have Mr. Rick Gordon here, who's our director of the Annapolis Department of Transportation. And Mr. Gordon, would you like to please give us a synopsis of our legislation before us today?
Alderwoman, I wish I could, except this is not legislation from me. This is from Jackie Guild, I believe.
Okay.
I had no role in developing this.
Okay. I saw you were here, so I assumed, and I guess that's not good, that you were part of this.
No, I was not.
Okay, fine. Now, are you here for anything else?
No, I was here to hear this, as a matter of fact.
Oh, great. Okay. Alderman Gay?
Yeah, I just was going over the staff report. Are you accepting comments now? And I'm not sure how this process works within the committee. Once we receive and make recommendations, are recommendations sent from the Office of Law, or are they sent from us?
We send them, if you have amendments or whatever, we have them sent and recommended to the body of the city council. So Alderman Savage has already put in his amendment, but if there's an amendment that you believe is worthy, then we can certainly do that. And we'll hear from our city council associate, Ms. Green. But can we let Mr. Gordon go unless we have any questions for him?
I will see you this week for the other parking legislation. Thank you.
Yes, you will. Thank you.
Our transportation meeting. Thank you, Mr. Gordon. You're relieved of your duties for today. Thank you for sitting in on this. And if it was anything else you wanted to add to our Public Safety Committee, you can feel free to do that now.
No, not at all. I enjoyed hearing the information that I did. I'm always happy to sit in on your meetings, Alderwoman. And I'll see you soon.
And we're always happy to have you. Thank you, Mr. Gordon. So
thank you.
You can be released.
Thank you.
Thank you. Our city council associate had something to say. Ms. Green.
Yes. Alderman Gay, if you wanted to make an amendment, you can do that within the committee. And what happens is I send it to the Office of Law and they put it in amendment form.
Yeah, could I do that,
Ms.
please?
Berger's here. And Mr. Alderman Gay, Carrie Berger, who's our assistant city attorney, is here as well.
Hey, Carrie, how are you? I wanted to make an amendment, though, I'm trying to find the exact line. I'm not sure if the finance portion of it is in this legislation, but the fine proposed is $100, and I would like to put an amendment to make it equal to a handicap fine, which is $500. But I'm not. Oh, it just says penalties. A person violating this section upon conviction subject to a fine is established by resolution of the city council. It did mention in the staff report a fine, though, but I guess we'll do that in a later resolution.
Since this is a new piece of legislation, I'm comfortable with the $100 for now. I mean, I understand your argument concerning increasing it to $500, just as with persons with disabilities. But I'm comfortable at this point with keeping it at 100. And this is something obviously that Alderman Savage took a look at, and I know he's heavily involved with the environmental community. I would venture to say that he talked to Ms. Geld about this, and this is probably the number that they felt comfortable coming up with, unless there was some other rationale for it. But I don't see one, and I do believe if they thought 500 would be appropriate, that they would have recommended that.
There are a list of other jurisdictions they included in the staff report. I guess that's appropriate because we would be, let me see. Yeah,
and we can certainly revisit it as we go along. If we find that many people are parking there that should not, then definitely we can certainly revisit that at some point, maybe after a year, since this is something very new. I will say this, I've been down to Recon Park several times, and I see people complying.
Well, I get emails that all the time. I remember me and Rob were talking about this, about people complaining because there aren't enough. So I'm happy to see this legislation coming through, in the hopes of 18 to 20 new. I'll shoot Jackie an email and figure out the timetable on that, because it doesn't say so. But it does also hint at the highest we could go is $350. So.
Okay. We can certainly, once we have our city council meeting and this comes before the full body, we can certainly have a robust discussion about it. And Alderman Savage, as well as Ms. Gower, can come and let us know what the rationale was for the $100. And if at that point we believe that it needs to be increased, we can certainly do it from the floor.
Absolutely. Thank you very much for that.
Certainly. All right. Any other comments about the piece of legislation, Alderman Gay?
No, that's all.
Okay. So can I get a motion as far as Alderman Savage's amendment? I guess we can start with that. City Council Associate, we can vote on this amendment now. So can I get a motion as far as Alderman Savage's amendment is concerned?
You technically don't vote on his amendment?
Yes, ma'am.
To pass
I think Ms. Green has something to say.
Oh, sorry.
Technically, you don't vote on his amendment.
Okay.
We just take this as a package. When you get to the full council, and then you adopt it if you wanted to. But in committee, you don't really vote on someone else's amendment.
Okay, that's fine. Okay, thank you for that clarification.
You're welcome.
Okay, Alderman Gay, based on what Ms. Green is indicating to us, can I get a motion for a favorable recommendation on O-14-20 to the full council?
I'll make a motion for favorable recommendation.
Second, all in favor? Aye.
Aye.
Aye. No opposed. And the motion carries. We will recommend this favorably to the full body at our council meeting. And at this point, Alderman Gay, before we go to adjournment, is there any other thing you would like to bring before this committee for the good of the order?
I'm thankful for everybody who has been on today. It's been a great learning experience. And yeah, I'm looking forward to the next meeting. It was great to catch up with everybody.
Absolutely. Ms. Berger, would you like to have anything to say for the good of the order?
Sorry, it took me a second to unmute myself. Nope, I don't have anything to add. Nice to see all of you as well.
Absolutely. Okay. Alderman Gay, can you make a motion that we adjourn since Alderman Payne is not here? A second,
Yeah,
all in favor? I know, I don't know how to do it. All in favor, aye.
Aye.
All right, adjourned at 5:27 p.m. Thank you, Ms. Green, for all your help as usual, and Mr. Jacques as well.
Awesome. See you guys.
Okay, bye-bye.